At Yale, we think of science as a team sport. You know, if you imagine a giant Jenga tower, every study adds a block, and every layer builds on decades of work that has come before. So about 15 years ago, our team published a landmark study. It was really quite powerful at the time, got a lot of attention. We reported that hospital organizational culture, the way people work together, what they value, how they make decisions in a hospital, affects whether you live or die if you have a heart attack. We found 5 strategies that helped hospitals have lower mortality rates, and hospitals that used all 5 of those strategies were able to affect an absolute 1% difference in mortality rates for heart attack.
What comes next?
Well, Jenga block 2. Once we knew that hospital culture affected mortality rates for patients with heart attacks, we wanted to see if we could influence culture. Could we change it for the better? So we developed a study called Leadership Saves Lives. At the time, a skeptical grant reviewer called it audacious, but you know, the best science always is, and it worked. The hospitals that had positive changes to the ways of working, to the organizational culture, also had lower mortality rates.
What are you investigating with the NIH funding you received?
Well, we're working on Jenga block 3 now. So we're taking what we learned before and applying it to sepsis care. Sepsis is serious. It's a life-threatening condition. It's basically an infection that can spread throughout your body really quickly. It affects about 2 million people in the US every year. And sadly, 300,000 people die. So most all of us know somebody who suffered from sepsis, including my mom, which it makes it really important work for me to be doing and for our team to be doing. On top of the human cost, it adds about $65 billion to our healthcare bill every year in the US. Certain patients are much more likely to develop complications, to get readmitted to the hospital, and to die from sepsis. And those are patients who have poor sort of social drivers of health. When we talk about social drivers of health, we mean things like not having insurance, not having access to healthcare, especially in rural areas, being of a certain race or ethnicity, living in certain housing conditions. So the real world nature of this work is what makes it so powerful. It's not ivory tower research. We're sitting side by side with doctors and nurses and hospital leaders who are really trying to tackle sepsis where it happens.